So for me, I mean, direct access is the ability for the public or patients to access care through a team member that is not the dentist. So we have the ability for someone to see a dental therapist, dental hygienist, and also a clinical dental technician. All three groups are able to carry out an examination within their scope of practice, so they can all effectively have direct access from the public.
So direct access was a change in the law that allowed patients to see dental hygienists and therapists without needing a prior referral from a dentist.
Direct access has been around for over 10 years now in the private sector. So we've been able to do that for a little while, and then more recently, just the last 2 years, within the NHS section of dentistry. So what it basically means is that a patient can go and see a dental hygienist or dental therapist for treatment within the scope of that clinician, but without having to see a dentist first. So it's a really, really good way of increasing patients getting access to care, really, and more importantly, to preventive care as well.
Dental hygienists and dental therapists in particular, that means that we can see a patient can come and have an examination, diagnosis and treatment plan within our current scope of practice.
So for me, direct access, really, I have the word freedom. That's what's been rolling in my head, that it means freedom, and it gives our patients, really, this is what it's about, the freedom to be able to see a dental professional, and in my case, a dental hygienist or a dental therapist, without having to see the dentist first, without myself as the clinician having to have a prescription to treat the patient as well. So that's why I keep having freedom in my head, but it's really around being able to enable access for my patients, whether it's privately or whether it's through the NHS as well. It just gives us that space to be able to care for our patients.
So it removes a number of barriers, A, for the practice and B, for a patient as well. So if we're talking about private dentistry or independent from the NHS, then, it means a patient can go see a dental hygienist or a therapist and have the treatment that they require and that they want without them having to see a dentist first. It allows the dentist to see their patients, more complex patients perhaps, things that are outside of hygienist or a therapist scope of practice. In terms of administration, it means that the dentist then doesn't have to write a treatment plan and write a prescription, be able so it removes that administrative burden as well for the dentist and for the practice as well.
The previous way of getting to see a DCP, whether it's a therapist or a dental nurse or a hygienist, would have been you have to have the dentist prescribe it, but now you don't need to do that.
If we think about NHS, well, in England and Wales, hygienists and therapists can now hold PIN numbers, personal identifiers, which allow them to open and close NHS courses of treatment. So exactly the same way as in the private setting, patients can see a hygienist or therapist, so they can examine, diagnose, treatment plan and deliver treatment within their scope of practice.
From my point of view, direct access gives patients the opportunity to receive care from certain dental professionals without necessarily needing a referral from a dentist. And in the UK, it's the General Dental Council that set these regulations. As it stands at the moment, edentulous patients, so those who don't have natural teeth, they can see a clinical dental technician directly for full dentures. However, if a patient has remaining teeth or implants, they need to first consult with the dentist. That can be a little limiting, especially in scenarios where you have a patient who may have a broken or lost denture, for example, and if they need urgent care. In such cases, if they can access a clinical dental technician directly, it would provide them with a faster and more convenient solution.
And parts of the treatment that the hygienist or therapist can't deliver, they can then be referred to the dentist to complete that part of the treatment. So maybe that there's need for a root canal, or they may need the extraction of a permanent tooth, or some indirect restorations obviously fall with outside our scope of practice.
I suppose when you really look at it, direct access to me is about you being able to use your skills, okay, so that you can actually develop and become the autonomous clinician that you know that you are.
So it removed that probably administrative layer almost. It gives the patient another route into a dental professional.
People call it direct access, but sometimes I think even the term is a bit of a barrier to actually performing direct access, because dentists work under direct access all the time, but we don't call that direct access, do we? So, I think really we're putting a barrier in our way by having a term for it, a name for it. I think if we just said, yeah, you can come and see me with or without a referral from another clinician, grand.
If you're working in dental practice in a multidisciplinary team, it's very easy, but for CDTs who are working in their own clinics, it's a little bit harder. Often those CDTs do have well-established relationships with local dentists, and they can seamlessly refer patients when an examination is needed, so that's not necessarily an issue. And at the same time, they will accept referrals from local dentists as well. But if the patient can access a CDT directly, it would make things much easier for them.
I remember when it first came in, I was doing a couple of lectures. I had one which was for dentists and for hygienists and therapists that are going to be working under direct access. And a couple of the dentists afterwards said, well, what do we have to do? And I said, nothing. It's not about, you don't have anything to do as such. And they said, but these are our patients. And I said, yeah, but they're also hygienists and therapist patients. We also have indemnity. We also have a duty of care. And yes, we will liaise with each other, but really nothing really is changing from what it was before, except they don't need to see you first to have a prescription to come and see the hygienist. That's the only difference. There's nothing else that you need to worry about.